Hope everyone is having a good day so far. An interesting quick show of hands of whose first time is it to a REBA Congress event? Oh wow. I'm not alone then. This is my first time as well. Not been to one of these, which is quite surprising because I've actually been in the industry for about 20 years, but there's always been people above me and around me that come to these events. So this is the first time for me. As introduced there by Jen, I'm Steve Thomson. I look after our broker and partnership distribution for EMEA and for an organisation called TELUS Health, which may not mean a lot to many of you, but the brand LifeWorks or Morneau Chappelle might be something that resonates, and that is who we are. We got acquired as a business 18 months ago. And my focus is really just to arm you today with some insights and some lessons around the data that's available, what it's telling us, and then more importantly, how we as providers, working with your brokers and advisors, can help you leverage that to drive some value out of your wellbeing strategies, and how technology then plays its role in that. So thinking about data, and today's a great example of that. We're hearing this all the time from global organisations who are looking to turn to the data to help drive strategy. The conversation today, the theme is very consistent around the challenges around what data is available, how do we use it, how do we make it make sense for us as an organisation globally, but then actually also in the countries where our people are present. And so first of all, what's the data telling us? Well, actually what we're seeing in our own organisation, what we know is going on around the industry, is that these dynamics are changing constantly. So our business is having to evolve, it's having to adapt to these constant changing landscapes. So even if we think about healthcare and the access to treatment, it's a constant challenge. It remains strained. I saw a stat, I think probably a week ago, that another 30,000 people have been added to the NHS waiting list, which is 7.5 million strong. So access to healthcare remains a massive challenge for organisations. The need for mental health support, it continues to be a strain on organisations, and employers are being leaned on more to provide better access to their people. Because actually the costs of doing nothing here are quite demonstrable when we think about impact on stress, productivity, absence, and fundamentally morale and happiness of your people, which are your most fundamental asset. And of course, rising cost of living. I didn't see the news today on interest rates, but it's not great. Everything costs a hell of a lot more these days. And that's putting pressure on people's financial security, which has the knock-on consequence to people's mental health and well-being. And so what we do as an organisation, or part of what we do as an organisation, is survey thousands of people across key countries in Europe, including the UK, the US, into APAC. So we have this large data set, and we can drill down into that to find out what's going on at workplace mental health level as a benchmark to pre-pandemic. And let's all face it, things have changed quite a bit. And by all means, come and speak to us after the session, because these reports are readily available, and the data that's available in those can help you spotlight on what's going on country by country and at a regional level to help tailor your strategy. But to think about Europe specifically, including the UK, you can see that country by country there are some nuances, but actually in the main, what we're seeing is that just a fifth of people in the workplace setup are deemed low-risk mental health. They've got everything in order, they're doing all right. There's a large chunk of people that then sit in moderate risk, which is understandable. We've all got things going on in our personal lives and work lives. That kind of makes a bit of sense. But the frightening figure is that a third, or over a third, are deemed to be high-risk mental health. And that's presenting itself in several ways. And again, this is benchmarked to pre-pandemic, so 2019 sort of data, but we're seeing up to 3 times more high-risk mental health, up to 4 times more addictive, alcohol abusive natures of people coping with the circumstances that they're faced with. And now 1 in 2 are more sensitive to stress as that mental health landscapes become more complex over time. But like I say, it's not happened overnight. This is not an overnight change. This has been happening over a period of months and years. If we think about early pandemic, where the adrenaline of change and what was happening when those lockdowns started to come in, the anxiety that people felt had a massive impact. There was a sharp rise in mental health, and this topic and theme of isolation started to become more apparent. Fast forward 12, 18 months or so, and as those lines become increasingly blurred between home life, work life, exhaustion starts to creep in. This theme of burnout starts to become more prevalent. And as I've said, those mental and physical health concerns, the complexity there started to really change. And then fast forward to current state, and again, now we're in a society where everyone's on edge. There's a lot of anger, there's a lot of cynicism going on. This thing of isolation still exists, but it's become a bit normal now. And that doesn't mean it's acceptable, but this is the change in the landscape, and I'm sure over the next 6-12 months it will continue to evolve. So I've addressed the data, we've got lots of it, there's lots of it in the market. So what? How do we now take it to that next level? Because this is the bit that we think is missing from the conversations I've been having today. I'm sure you've been having amongst your own businesses and peers. How do we take that data and help it drive consistency in what we're doing as an organisation to know whether or not it's making an impact and making a difference on our people? So here's some of the things that are already happening. I'm going to come back to breaking it down in a second, but if we think about some of the good things that are already happening in organisations, mental health being as a focal point as it is today, support in that area has become a high priority. Digital programs are driving and increasing access to support, reaching people in all corners of the earth, depending on their circumstances, what they do as a job, whether they're remote, office-based. But that's really helping organisations. Wellbeing programs are then looking at the wearable devices that we've all got between watches, rings, phones, leveraging that data into physical and corporate challenges, fostering this community of corporate challenges, help to drive engagement within an organisation, and you can use that data to tailor what you do in certain regions. And then, of course, we've got engagement surveys. We've all done the Gallup type surveys, big, heavy documents that we do once a year or so. But actually, these pulse checks that are more frequent give management and line managers and HR people this real-time feedback as to what's going on in the business so that they can pivot, have a look at their strategy, make a change before it becomes a problem. So all this stuff is happening already. But I want to talk about some strategies now around how we take the data that's available, that you already got access to or that you can get access to, and start to build a strategy that's consistent for you as an organisation. So data, first of all, helps set the benchmark. You need to know where you've come from to then know where you're going. If you haven't got that starting point, it becomes really difficult to know whether or not what you're doing is making an impact. So setting those clear metrics is vital. It allows you to be consistent, set some standards and roll it out over other areas of the business. Setting a good, strong cadence about how you're going to collect that data, when you're going to collect that data, so that you can analyse, review and make the steps that you need to make. Looking at your historical data, before you start to implement change, have a look at where you are today. Take the data you've got available, set those benchmarks. That's how you know whether you can track trend over time. But then, of course, working with your brokers, your partners, we see this all the time, being able to leverage the data sets from various sources and have that ear to the ground as what's going on in the industry at a wider level. It can be quite insular within your organisation to think that what you're doing is right, but actually knowing what's going on in the industry at a trend level can help you benchmark where you're going to be. So benchmarking and setting standards is where you need to start. That's where you can then build. You then take the data from what you're doing and you start to use that to inform where you go next, what's working, what's not working. Is this right? Well, let's get it right here, and then we can standardise that across the business as we roll it out into different organisations and departments. And then whilst those core principles will be consistent, actually the data interrogated in the right way with the right support will allow you to really tailor what you're doing to make sure it meets the needs of your people where they are. Centralised and personalised wellbeing. The word I've heard the most in the last 6 months is consolidation. I think there's something like 10,000 mental health apps available. I'm pretty sure that as a collective here today, we probably took up quite a few of those over the last 3 years, where there was a lot of reactive behaviours during the pandemic. There's a problem, quick throw that at it. And it's not uncommon for us to talk to organisations who have 10, 20, 30 different solutions across their organisation in different countries. It becomes impossible to navigate it as an individual and communicate it and engage your staff as a HR leader. So thinking about centralising those platforms, there's no one size fits all. You cannot find one solution that's going to fix everything, but consolidating it makes it a hell of a lot easier to communicate your programme, drive engagement, get better outcome as an organisation. But then with the data that sits within that, it's all about personalisation. And I'll come onto this in a bit more detail, but being able to personalise that experience, because we all need different things at different times in our life, and we will all use it in different ways. So thinking about that, and I'll talk about it in just a second. And then lastly, having that clear idea of what good looks like so that you can measure the progress over time, so that you as an organisation know the impact of what you're doing and where you're all trying to get to. So you're all on that same journey together, rather than having a solution in this country that worked for so many years and then a solution in this country or department. Being able to have a consistent and clear message helps drive communication, which will help foster higher levels of engagement. So in summary, data helps organisations maintain a consistent approach, but ensuring the efforts are aligned to both personal needs and organisational goals is where you make the difference. Because what you do for this person here is not necessarily going to resonate with this person here. And it would be remiss of me not to talk about technology. I'm not going to talk about AI. I'm not there yet, but it's coming. And I think broadly it's going to be really good for us. But how do we now leverage the technology and the data to really drive impactful change as an organisation? Because we know that technology vastly improves access and reach of what you're doing in wellbeing, whether that's at domestic level and being able to reach various workforces based on whether they're remote or office, or whether that's at a scale where your organisation is in multiple countries. Technology vastly improves access, vastly improves engagement. And on the engagement side, the data with the technology indicates that we engage more if technology is involved. How many apps have we all got on our phone? Don't know, because there's so many of them. But the fact that they're there, I'm more likely to engage in something that's in my pocket and in technology. Doesn't mean I have to use just technology to reach the end solution, but technology is the enabler that improves that access and engagement. Everything is about personalisation, though. I've said it a few times. We all want and need different things in different ways at different times. And technology allows you to do that through looking at how I behave in my own wellbeing programme, what I use, what I read, how I read it. The technology will then start to feed me content, will then start to change what I see and how I see it and how frequently I see it. So technology helps keep things personal whilst being able to be consistently rolled out as an organisation across multiple countries and regions. And ultimately, at the end of the day, technology will be the difference between what's working and what's not. And we know that the impact of using technology drives significant levels of effectiveness. we all use it in very different ways. Younger populations, far more tech savvy, will lean in on technology first as a solution, and their focus is probably more of a high level at mental health. Whereas if we move through the generations, and let's face it, you've probably got 4 or 5 in any given organisation these days, as you start to creep towards the older populations, actually there's a barrier to adopting technology possibly. And the focus that they will have on health will be more on physical health or chronic case management over mental health. So being able to cater for those different needs at a generational level are going to be vitally important as to what you measure at the end of it in terms of impact. But then also looking at where people work within the organisation. Remote workers are more likely to be susceptible to feelings of isolation. So technology and data helps keep them connected to you as a business, the culture and the people. Whereas in an office environment, if we're in the office, we're more likely to see people, so it's okay, but actually you're more likely to be in a high stress role. So the focus that you're going to have is going to be on stress management and being able to access something quick and immediate without the need to wait for support. So being able to identify that you've got different generations, they need different things at different times is going to be significant. So fundamentally, the data on technology's role highlights the importance of being a tailored solution, because you've got diverse needs in the business through both people and workplace, and technology is going to be the enabler. But in closing, fundamentally, you cannot improve what you do not measure. Okay, and we know that, that's not a surprise. And I think we can look at this in 3 pillars. We're looking at your people and their health and well-being. Are they okay? Do you have the right support and programs in place for them? Do they feel motivated? Do they feel included? As a business in your infrastructure, we're looking at, are the policies in right? Are the practices standard? Can it be rolled out? Is it working? Is it having an impact? And then lastly, is what you're doing working? Are people using it? Do we need to change? Do we need to think about doing something different in one place compared to another? Oh, didn't mean to press that one. And all I really wanted to say, just on closing and finishing this slide, was that we know there is a significant and measurable effect for businesses who have above average levels of investment in well-being, fundamentally outperform their peers, have higher levels of engagement, higher levels of profitability. And at the end of the day, what gets measured gets done. So I've got about a minute and a half left. Hopefully you've taken something away there from today. Thank you for listening. We are on booth 15 and we'd love to talk to you and hear more from you, but also share some data with you afterwards as well.
Thank you so much.
Nice.
And before you escape, ahead of time, which I know you weren't expecting to do, but very well timed, we've got time for a couple of questions. There's one on Slido. Please do add any others if you'd like to. So we'd welcome your insight on how to manage a consistent approach when dealing with different cultures globally.
Yeah, great question. And that we realise that cultures across the world will interact with mental health in very different ways. Mental health in APAC is not something necessarily you talk about, so actually work-life services is where we would lead on our solution. But I think managing a consistent approach, technology helps with that. Having a consistent program and tool that you can direct your employees to is the start. The way they then interact with that is where working with your providers, brokers, advisors can help ensure that that consistent solution that looks and feels the same wherever you are in the world is tailored and relevant to wherever you are in the world. So if I'm picking up, in an EAP setting, if I'm picking up the phone in Germany, I'm speaking to someone in Germany who understands culture, language and everything. But actually as an organisation, the tool that's being used is the same thread across the entire business. So it becomes very easy for HR to communicate that.
Okay.
Hopefully that answered the question. If not, come and find me and I'll have another go.
Excellent. Thank you very much. Thanks, Stephen.
Thank you, everyone.